At the Global Liver Institute, we believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live. Hello and welcome. My name is Donna Cryer. I am the founder and CEO of the Global Liver Institute, and I have the great privilege and honor of being your host for this episode of GLI Live. This is National Nursing Month. Of course, for those of us who are patients, every month should be National Nursing Month. And I have here a very special guest to discuss the value of nursing to liver health. I voted to just have me write a poem, odes to the value of nursing to liver health from my personal experience, but I was persuaded by the team to invite a special guest to have this conversation instead. But if anybody would like to hear me just wax eloquently about the incredible value of nurses and how much I treasure, love, and value them, I'm happy at any time to take that call and to do that episode. But here with me is Jennifer Slepin, who has several wonderful perspectives on both nursing and liver health. So welcome, Jennifer.
Thank you. Delighted to be here with you, Donna.
Thank you. Why don't you share with our audience what connection you have to liver health and the field of hepatology?
Okay, happy to do it. So I am a liver patient as well as a nurse. I don't know when I became a liver patient, but in about 1992, I used to be an avid blood donor, and I got a letter from the Red Cross after a donation pretty much saying, thank you, but no thank you. Your blood tested positive for what they HCV, which I didn't know what it was. You know, you think back then we didn't know a lot about hepatitis C, but in fact, went to my primary care doctor who said, oh, you have a virus. We don't know a lot about it. We know it's relatively slow moving. So let's watch and wait, watch the wine. You know, he didn't even tell me to stop drinking. So at the same time this happened, my older brother, John, who has now passed away, he had a lifetime struggle with addiction. He was a wild child and drank a lot, used a lot of drugs, IV and otherwise. And so I really focused my attention on him. And as his health declined, I mean, he had hepatitis C, and then on top of that, he was drinking. And I was just very happy to hide behind my shield, what I call my shield of immunity. I knew I had the same disease that he had, but I thought as long as I'm taking care of everybody else, nothing's going to happen to me. So, you know, right? I think that's
I wish for every caregiver, and having been a caregiver myself, that was an actual shield of immunity. But what often happens, as you know, is that the caregivers don't have themselves on the list, and their own health starts to decline. And so, you know, we need to reach out and give care to all the caregivers.
Absolutely. It's a big theme in nursing, particularly. So to make a long story short, my brother passed away from end-stage liver disease in 2008. And at that time, I realized, you know, I went to a hepatologist and I was told I had early cirrhosis. Mm-hmm. There was no question that I had to focus on my own health. So I went to UCSF in San Francisco. I moved to San Francisco and was very, very fortunate to be assigned to Dr. Nora Turow.
The great Nora Turow. That is fortunate. She is brilliant.
Brilliant, phenomenal. And she cured me of Hep C. It took a while because I think when I first met her, direct acting antivirals weren't even available. Right. But And we tried. I mean, I actually tried to be cured 3 times.
Mm-hmm.
Interferon, the
In
bad.
those days, yes, to be cured meant you were really in the hands of a miraculous practitioner, to work in that era of to be able to cure before there were cures.
Yes, and to this day, I consider it, a great blessing in my life to have just, landed there. But after 3 attempts, and the last time with a DAA and ribavirin, because I was treatment resistant, I was cured in 2016, and I took off across the country in my Prius with the idea that who will I be without hepatitis C? I really had so defined myself by it. And when I got back from that trip, I reached out to Nora and I said, it's sort of kidding, but I said, I'm going to buy an Airstream and you and I are going to cure Hep C in California. And she called me a few weeks later and said, do you want to do that? And I'm like, yes. And so Nora and I launched a program, and you see those license plates up there.
Mm-hmm.
That was my truck and my Airstream. And we launched a program to teach primary care doctors in 13 counties in Northern California how to treat and cure hepatitis C. And we were very successful. She and I often say we will really never know how many lives we touched,
right.
But we really recruited sort of an army of treaters. So that's sort of my intro. And at that point, when I was cured, I often say that it felt like a superhero came out of my chest. And I thought the remainder of my nursing career will be dedicated to liver health, because, as we know, liver disease, most of it is treatable,
right,
often reversible.
Mm-hmm.
But it's just awareness.
And in many ways preventable.
Exactly.
So that is an important message too for people, that with some vaccines for hepatitis B, and there's a whole episode with Dr. Bob Gish on it. But preventable, reversible, treatable. It caught early enough, it's really not. You shouldn't end up, in end-stage liver disease like your brother did, like I did for my autoimmune disease. We need you back in the Airstream, I feel, as we work with Dr. Collins and the administration and trying to really catalyze sort of a new era of and movement of getting everybody else cured who wasn't reached. I feel like we need to get you back in the Airstream and scale that, maybe get you 10 more Airstreams.
Yes. Or at least a van.
That. Okay, a van, a bus. When I visit, we tour, several hospitals and health systems, and I take note in the parking lots of who has a bus, who has a van, what can we equip it with, and take that out. And so, you and I think a lot alike about how to really just reach people and bring care to them, rather than expecting that they're going to, take a break from all the other responsibilities that they have in their life, let alone if they're caregiving for somebody else as well, and come to us, in our great, temples of medicine.
Yes, absolutely. And, our mighty, beautiful livers rarely complain. So it's another thing. How do we get the general population to understand that liver disease is real, and how they can be involved in it? And I love the idea. Let's buy a van, Donna.
I was going through some family pictures recently, and pointing out that I did learn to drive on my father's van and my mother's large Cadillac. So I can drive anything short of a semi truck, and maybe I'll get that license at some point if need be.
You could do it.
But I can definitely drive a van. So we're halfway there. So when were you already a nurse when you were taking care of your brother, when you received your own diagnosis? Okay. And then how did your career sort of change, with that information and with that experience?
Well, yeah, I've been a nurse for a long time. I don't even want to say how long because it kind of gives away. Besides this gray, it kind of gives away. But yeah, I've been a nurse for a long time, and as nurses, one of the beauties of being a nurse is that you can really go in a lot of directions. So I've worked, clinically. I worked in an open heart surgery unit. I worked on mother baby. I've worked for pharma. I've done home health. I've done it all. But the cure and the realization that, number one, had we been able to, had these drugs been available when my brother was alive, they may not have helped his issues with addiction, but I think he was always so worried about his liver
Right.
health that maybe we could have saved him. But I think that was a pivotal moment
Right.
in my life that, my God, this thing that I thought was going to kill me is gone. The demon has left the building. And so was really the moment. And
Mhm.
so that's what changed me. And to this day, I'm very committed to liver health. I mean, it's my passion. It is my calling, I believe.
I know the feeling.
Yeah, yeah,
uh, when you talk to other patients, do you share with them your experience, and does that change how um, interested they are in receiving the information or taking the next steps?
definitely. So when Nora and I were doing the work together, the pandemic just stopped us in our tracks
Hmm.
because it was all field based. So I left California and I came back to North Carolina, where I am now, and I went to work
Hmm.
at Duke as a triage nurse in the division of hepatology. And so, I sat at this very desk on the telephone all day, every day, fielding calls, really supporting patients
Hmm.
with all kinds of GI issues, but primarily hepatology. And when I would get someone who had hepatitis, I would share with them um, if they were interested. You have to be
Hmm.
careful.
Right.
But I would share with them because there's a lot of shame, I think,
Hmm.
not just in hepatitis, but in liver disease. Because if it's steatotic liver disease, there's shame around if you're overweight. If
Hmm.
you're drinking, there's shame around your drinking. I think these days, and the evidence does show that the primary way these days of getting viral hepatitis is through injection drug use. So there's a lot of stigma on that. And so there was so much shame when folks would call in, and I would just say, let me share my story with you. And it was abbreviated, but I
Hmm.
would notice immediately that they would take a breath like, oh my God, not only are you a nurse and you know about this, but
Hmm.
I can identify with you. And removing that veil of stigma that is so great. I mean, big, it's not great. But it really does keep people from seeking care. So,
Hmm.
yes, I think sharing my story absolutely helped patients. I think it also, I have to say that in the healthcare system, stigma lives there too.
Absolutely.
And so, I've been able to really share with my colleagues. We're all human, we have
Hmm.
preconceptions. And I think a big part of liver healthcare in general, but specifically
Hmm.
liver health, is just accepting someone where they are. And how do we help them? As a nurse, my mantra was always, I would say this to patients. I say it now, I say it to myself. How can I be an active participant in my own fate?
Right.
Um, and that is I think that's what nurses do a lot.
Hmm.
We're here not only to educate and provide scientifically and evidence-based intervention, but we
Hmm.
also are here to sort of touch the human part of a person and say, how can I help you make changes in your life? And I will say that was very operative for me. As my liver is damaged and I have cirrhosis.
Hmm.
And I think, all right, I'm in the driver's seat here. What are the things that I can do to optimize my outcomes? That was one of the
Right.
first words Nora used with me. She said, let's optimize your
Mm-hmm.
health. It took me a long time to really make that my own, but I think that is a real message that nursing can give to their patients.
I think that that's so important because I think that to borrow a phrase from George Bush, the physicians, particularly for patients with chronic illnesses or serious illnesses like end-stage liver disease, they suffer from the soft bigotry of low expectations. You should be happy that you're alive. You know, it told me post-transplant when I started talking about other things. Well, you're alive. You know, I'm like, yes, but now that I'm alive, I want to thrive. And I use the word optimize myself often. I'm thinking, you know, I'm now almost 30 years post-transplant, and so I want to be the best and healthiest version of that. Not just, okay, I'm still alive. That's great, but you know, can I work out? Can I travel? Can I, you know, how can I be the best version of this to make the best use of this gift, and frankly all the investment in you know, in healthcare and conversations that can be. And so what can I do through nutrition or movement or even meditation and just taking good care of my mental health, really optimize you know, my overall health. And so it's also a message that we give in the you know, in the context of fatty liver disease or steatotic liver disease, if we're going to use some Latin. And because I think that there's an opportunity, particularly in the wider community that we've created with endocrinology and cardiology and sports medicine and everyone now who's been part of our NASH Council, to optimize all of the cardiometabolic and hepatic risk factors for a person. If they're coming in through a door for their fatty liver disease, treat their fatty liver disease now that we have medication for that, but also make sure their hypertension and their high cholesterol and their diabetes are under control. If they come through a diabetes door, make sure not only their diabetes, but their cardiovascular and hepatic risk factors are dealt with. And so that's a message in terms of optimizing, you know, the person, that I think we have an incredible opportunity to do. And I hope that message gets out through nurses and others.
Yes, I think for nurses, I was thinking about this as we were going to talk, and what can nurses do? What can my colleagues do? And I do believe, you know, when you think about nursing, there's a fair amount written about that we are often a very unhealthy group of people. And it depends on where the nurse works.
I've stopped bringing donuts to the
yeah.
I bring healthier snacks now when I go to the nurse's station to visit people.
Yeah, that's we appreciate that. But so as I thought, well, what would the message be to my nursing colleagues about liver health? Well, number one, if you're not a hepatology nurse, and the fact that the liver is so silent and someone is coming in for something else, you know, how do we raise the awareness in the nursing community about this? And I do believe that focusing, number one, on your own health. Oh, look, do you see that?
We're celebrating that. We are celebrating that.
Oh, I guess
that phrase, that moment.
Yeah,
you were trying to do that earlier. Yes, exactly. Yours were mine.
There you go.
My present. But yes. So say that again, because we want to celebrate that moment. Nurses need to take care of their own health first and really embody what they are teaching and telling their patients.
And I think that in doing so, we not only exemplify good health, but it also just spills over into your practice. I mean, I really notice it. I'll just, full disclosure, in fact, Nora and I had a conversation at AASLD. I disclosed to her that I felt like I was heavier than I had ever been. She said, get a GLP-1. And I mean, she wasn't flippant. And in fact, I did. And it has been so effective. And it has really allowed me to take control of my own health, which has really, it's amazing. Just, it's made me start exercising. It's made me realize that I have agency. Uh,
Mm-hmm.
and so I think that is one thing. The other thing, though, I think,
Let me before you go to that point, I really want to emphasize that, because I think some people are afraid of trying them, or see it as a crutch, and a lot of people are judged for using those, and I want to make sure that we speak to that, and I just love the fact that it triggered a cascade of other healthy behaviors that I sort of gave you the jump start that you needed to know if you can be successful in this, then it wasn't a crutch, it was a jump starter for you and other healthy
absolutely,
behaviors.
absolutely. And, we're starting to look at obesity in a different light.
Mm-hmm.
You talk about stigma and shame. And I think when someone is sitting in that stigma and shame, um, no matter whether it's not necessarily valid. I mean, but there's this assignation, I guess, that someone who suffers with obesity is lazy, eats the
Mm-hmm.
wrong things, and that is not the case. And so, as I said, for me, a real cascade of it lifted some of
Mm-hmm.
the negative self-talk that made me say, "Oh, I feel like we can educate ourselves." But the point I wanted to make,
Mm-hmm.
that often if you're a nurse and let's say you're working in a orthopedic practice,
Mm-hmm.
it's so specific, or
I've had my
we,
knees done, so that's fine. Now I've had
yeah,
both
yeah,
knees
yeah,
replaced, so
yeah,
that's
or
that's fine for
primary
starters.
care.
Yeah.
People are coming with
Mm-hmm.
not necessarily a concern about their blood sugar or their
Mm-hmm.
weight, or and so the nurse who is already overwhelmed and perhaps not as in touch
Mm-hmm.
with her own well-being as they might be.
Mm-hmm.
I feel like nurses, we need to be educated. We need to educate ourselves. And that comes from number one, finding out maybe about our own liver health, asking our primary care doctors, maybe ask for a FibroScan. They're
Mm-hmm.
so diagnostic because there's the truth right there. It's not your liver functions, but
Mm-hmm.
I think if we begin to just educate ourselves, I know there's some resources on your website,
Yes.
and then the American Liver Foundation has a really great resource section, or familiarize with the AASLD, the new guidance, whether it's for
Mm-hmm.
viral hepatitis, whether it's for steatotic liver disease. Now, some nurses may say, I'm working, have a family, I'm
Mm-hmm.
tired, but I think it is up to us as sort of the front line to really, my awareness these days is
Mm-hmm.
that liver health is almost the hub of
Mm-hmm.
so many other health issues that
Yeah.
I think nurses can really be at the front lines of awareness.
I absolutely agree. And having been trained directly by Donna Thiel, I would absolutely say that the liver is the hub of your overall health, cardiovascular and otherwise. Certainly endocrine. The liver has more than 500 different functions, and everyone has a liver, so everyone should be concerned about their liver health. It really is essential, and I love the fact that you've gone ahead to be certified as a public health nurse. We were talking about my individual and GLI's membership in the American Public Health Association, and how important liver health is public health is one of our most successful campaigns, and I think it's one of the most important because all of the levers of public health, education, food policy, parks and recreation space, transportation issues, can all have an impact on people's ability to act in ways that optimize their liver health. And so we need to bring that message out of sort of the silos of hepatology and really into where people eat, work, pray, and play. And so I'm
I
so
love
excited
that.
you've been carrying that message personally and professionally for a long time.
Absolutely.
So, you know, what does the future of liver health look like, as particularly as nurses and advanced practice providers are more and more at the forefront of delivery of healthcare, and certainly of health education? What does the future of liver health look like, or how can we shape it to look like what we need it to look like?
You know, I love that question, Donna. And as I prepared to speak with you, I thought, okay, how do we make a change here? Which makes me want to create some sort of liver health, not liver disease, but a
Right.
liver health
Mm-hmm.
module.
Mm-hmm.
Maybe we can collaborate
Let's
with that.
do that. I think that is absolutely the next step with our Liver Health is Public Health initiative, as we've been talking to deans of schools of public health. But my father was a sixth grade science teacher. And I think, that is where, we need to start, making sure that liver health is as important as heart health and brain health, at every step of the way. And we'd love to work with you on that.
Well, and you think about, I mean, we could start with food, and I think we're very aware, staying away from processed foods, teaching people, go to the farmer's market, get fresh vegetables. And I think when you think about the future of liver health, I think often we go to the doctor and they tell us what to do, but they don't tell us how to do it.
Yes, exactly.
And I think
many of
nurses,
them don't know themselves. So in all
exactly.
fairness, and it's not part of the medical school curriculum, and we discussed how hard it is for nurses. And so I think as advocates, we have a large role in helping everyone figure this out and make it make sense. We have health coaches. We have, so many resources now to reinforce healthy behaviors and help people figure this out in the context of their lives. I travel a lot, and so, I can be healthy at home, but how do you take the show on the road, as they say, and keep up, good habits, integrate, movements, or, find something, find, good things to eat. If, eating out is the norm for you, it can't be a special treat every time. And so, just helping people, really think through how to put this into practice is, what I think I'm really excited to have an increasing number of community-based organizations through our Liver Action Network, to help individuals.
I think the question, if we were going to share with the general public and the healthcare system,
Yes.
The question is what I said before. How can you or I be an active participant in my own health outcomes?
Yes.
And I think, you're out to dinner and the creme brulee is which is really one of my weaknesses. But to be aware enough to say, do I want this today? Well, maybe you do, but not tomorrow and the next day and the next day. So helping,
maybe you want to taste, if you're the type of person who can take a taste. Some people aren't. So know yourself, know thyself, as Aristotle said first, I think. And build something that works for you. It doesn't have to work for everybody else. It only has to work for you. If it looks weird, that's okay. But if it works, then that's what's important. Some people, focus on breakfast. Some people don't eat until, some people intermittent fast. And so as long as it's sort of a healthy way, and you're watching, protein pills, and it fills you with more vitality, and your labs are going in the right direction, then, it just has to be right for you.
A mindful practice of living.
Absolutely. And you don't have to do everything at once. Sometimes, people get exhausted when they see like all the things that you could possibly do to, live for 100 years. And I was like, I think if I just maybe eat a piece of fruit and take a walk today, I'll be, I will suffice. I will call it a success.
One day at a time.
That's right.
One choice at a time. Absolutely.
So, Jennifer, it has been a delight to talk with you, and I look forward
Absolutely.
to working with you, and always our friends at Duke, of course, and Dr. Geralt, of course. We're very excited to just begin this conversation and honor both nurses and our hepatology, our hepatitis colleagues as well, with these continued conversations to raise awareness about all of the different types of hepatitis and all the different new options, and the rigorous research and outreach that's available now. So
It's been a delight and an honor to talk to you today, Donna. Thank you.
Have a great day.
All right, you too.
Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well, and stay connected.